Ever since Patricia started taking EpiJoint, which has that new ingredient Epitalis in it for mild arthritis, she's got a whole new lease on life. Even discovered a passion for blacksmithery. She makes horseshoes, medieval armour, and her favourite, the mace collection. She's out the back making a ceremonial claymore right now. Yep. She's never been happier.
Evening, everyone, and welcome to Musculoskeletal Health Awareness Month and the first of our amazing MHAM Consumer webinars. My name is Helen Jentz, and I'm a member of the team here at MHA, and I am thrilled to be here tonight to introduce our amazing speaker, Professor Kim Bennell, and this incredibly relevant webinar theme, Building an Exercise Program for Arthritis and Musculoskeletal Health. I would like to take this opportunity to acknowledge the traditional owners of the lands on which we are joining the webinar this evening. On behalf of Musculoskeletal Health Australia, I pay my respects to the traditional owners and custodians of these lands and acknowledge and uphold the traditional owners' continuing relationship to the land and waterways. Before I get started this evening, some housekeeping. We will have the chat feature open throughout the webinar, which is being monitored. Please feel free to put questions or comments in the chat, and we will endeavour to discuss them during the Q&A part of the session. Also, if this evening's webinar raises any questions or concerns, please make sure you call the Musculoskeletal Health Australia Back Pain, Arthritis and Musculoskeletal Conditions, or as we like to call it, BAM, helpline on 1800-263-265 to speak with our highly qualified healthcare professionals. Exercise. Love it or hate it? I think we all know it's necessary. What's that saying? Move it or lose it. Another and probably more positive way to put this is movement is medicine. And if there is someone who knows all about that, it's our fantastic expert this evening, Professor Kim Bennell. Professor Bennell is a professor of physiotherapy and the director of the Centre for Health, Exercise and Sports Medicine at the University of Melbourne. She holds the prestigious titles of Melbourne Laureate Professor and Redmond Barry Distinguished Professor. Throughout her incredible career to date, Kim has focused her research on improving outcomes for people with musculoskeletal conditions, especially those with osteoarthritis. Through her work, she highlights the importance of lifestyle, including how physical activity and psychological strategies can improve overall health and well-being. Please welcome the incredible Kim Bennell.
Thanks very much, Helen, and you've given me a very big boost there. So thanks very much for the invitation and the opportunity to speak to you all tonight about exercise. So I'm going to share my screen first. Can you see that there? Great. So I'm talking about, as Helen mentioned, building an exercise program for arthritis and musculoskeletal conditions and trying to keep it pretty practical tonight. And hopefully if you've got some questions at the end, we can discuss those as well. And I'd also just like to start by acknowledging the traditional owners of the land of Australia where we work and I pay my respects to elders past and present. So by the end of this talk, hopefully you should understand why exercise is essential for arthritis and musculoskeletal conditions, know the types of exercises that you can be doing, feel confident starting or adjusting an exercise program, learn how to modify safely for pain and flare-ups, and have some strategies to help you stick to an exercise program. So firstly, well, why should I exercise, or why should you exercise? And as Helen has mentioned, we know that exercise is good for arthritis and musculoskeletal health. she's already mentioned, we already hear the terms movement is medicine, move it or lose it. And they're all there because they are true, and we know that they are true. And so that's why we promote exercise, because of the benefits that we know it can give. But many people with arthritis and musculoskeletal conditions are in a bit of a vicious cycle. They're physically inactive and they're not meeting recommended exercise levels. So there's this vicious cycle of physical inactivity. So people are physically inactive. That leads to deconditioning. That leads to a further increase in symptoms and reduced function. And so then people feel like they should be, physically inactive. And it's this vicious cycle that just goes on and on. And so we need to break that cycle. And people with musculoskeletal conditions and arthritis know that there's a whole range of symptoms and impacts that the conditions do have on them. It leads to pain, reduces function, it can impair balance and fall and increase people's risk of falling, joint stiffness. People often have a range of other health conditions as well. So they're not just dealing with osteoarthritis or arthritis or another musculoskeletal condition. They're dealing with a whole range of other things such as heart disease, diabetes. They can also have overweight and obesity as well, can lead to fatigue, poor sleep, and muscle weakness. So there's a whole range of factors that are associated with arthritis and musculoskeletal conditions. But fortunately, exercise can actually address a whole range of these factors. So not only just the pain and function that we often think about, but a whole range of these other factors as well. So it's going to have a range of benefits. And we know this from evidence. I'm not going to give lots of data and research today because this is more a practical talk, but we do know that this is all backed by scientific evidence. And this was a study that came out just recently, and it summarised all of the different systematic reviews across 45 different long-term conditions to look at the evidence that we have for exercise-based interventions. And each of these systematic reviews in different conditions contains a whole number of clinical trials. So what they're synthesizing in this particular article was the evidence from hundreds of clinical trials looking at the effect of exercise. And in fact, they included 990 clinical trials that included nearly 1 million people across, as I said, nearly 45 different long-term conditions. And this might look a bit busy, but basically the size of the circle indicates the amount of evidence supporting exercise benefits in a whole range of different conditions. And here in the red box is all the different conditions where there's very good evidence to show that exercise is effective. So you can see arthritis is in there, back pain is in there, or painful conditions is in there, but all these other ones as well: cancers, asthma, stroke, cardiovascular disease, dementia. So we know that exercise has really positive benefits for a whole range of conditions. So that's going to have overall health benefits for you. And then, as I said, there's a whole range of clinical trials in all of the different arthritis and musculoskeletal conditions, looking at a whole range of different outcomes. Some are looking at the effects of exercise on sleep. Some are looking at fatigue. Some are looking at function, pain, and so forth. So there's multitudes of research evidence looking at a range of different exercise for people with osteoarthritis, arthritis, and musculoskeletal conditions. And so we know that the benefits of exercise are particularly around pain, function, but all of these other things: quality of life, reducing depression, anxiety, and stress, reducing fatigue, improving sleep, reducing stiffness, and so forth. So hopefully I've convinced you that exercise is beneficial and you all want to be undertaking exercise. I think another thing that people with arthritis and musculoskeletal conditions can worry about is that exercise isn't safe for them. They think, oh, well, for example, my knee joint's worn out, so I shouldn't be doing exercise because the cartilage is worn down. And what we know that is in fact not correct, that exercise is safe for people with arthritis and musculoskeletal conditions. So we know that again from the clinical trials where they measure people's adverse effects of exercise, and we know that any effects of exercise that are adverse are generally minor and temporary, such as just an increased flare in pain and so forth, but overall very safe. And so, as I said, particularly in my area, people with osteoarthritis often think that if by doing exercise, they're going to wear down the joint. And we know again that that's not correct. It doesn't change progression, and it certainly doesn't increase one's risk of having to have a joint replacement. In fact, it's the opposite. Exercise can reduce the need for having to have a joint replacement. What we also know from the evidence is that exercise is as effective or even more effective as common pain relieving drugs, such as non-steroidal anti-inflammatory drugs, but it has far fewer side effects because some of the pain medications that people may be taking can have serious adverse events or serious side effects. And so we know that the effects of exercise is actually, as I said, similar or even greater than. So sometimes people think that surely drugs must be more effective, but that's not necessarily the case, particularly, as I said, with these sort of pain relieving medications, and certainly much safer than pain relieving such as opioids, which can often have serious side effects. So hopefully I've convinced you that exercise is effective and that it's safe. And so it is a good thing that we all should be doing, but particularly for people with arthritis and musculoskeletal conditions. So what should you do before you start? Hopefully, as I said, you might be here at this webinar because you want to start an exercise program, or you may be doing an exercise program and you want to see that you're doing the right thing, or you might have been doing it and you've stopped a little bit. But what should you do before you start, or you've had a little break and you want to get back into exercise? It's always good to see, well, should you go and see a GP first to sort of get clearance? And there's this adult pre-exercise screening system that's been put together by Exercise and Sports Science Australia and some Sports Medicine Australia and some other exercise organisations. And they basically ask a few questions, 6 questions, to see whether or not it's a good idea for you to go and see and get some clearance from a GP. So the first thing is, has your GP or a medical practitioner ever told you that you have a heart condition, or have you ever had a stroke? Do you ever experience unexplained pains or discomfort in your chest at rest or during physical activity or exercise? Do you ever feel faint, dizzy, or lose balance during physical activity or exercise? Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months? If you have diabetes, either type 1 or type 2, have you had trouble controlling your blood sugar or your glucose levels in the last 3 months? Or do you have any other conditions that might require a special consideration for you to exercise? And that can include your arthritis or your musculoskeletal condition. But if you've answered yes to any of those, they do recommend seeking guidance from an appropriate healthcare professional, an allied health professional, or a medical practitioner prior to undergoing exercise. So it can be a good idea to just go and get yourself checked to get some clearance for undertaking an exercise program. But you may also want to see an exercise professional to help with designing your exercise program, giving you some personalised exercise prescription and helping to monitor how you're going. So some people may find that beneficial as well. So seeing a physiotherapist or an exercise physiologist or a sports and exercise physician, although you will need to have a GP referral to see a sport and exercise physician. But consulting an exercise professional can be helpful, as I said, particularly if you feel like you're not that confident in terms of setting up a program for you to follow that suits your particular needs. It's also really good to take some baseline measures before you start, because you want to see if there's any changes. Are you getting better? Is it getting worse? Like, you want to have some baseline measures to know how you're going and to measure your progress. And some of those measures, they could be very simple and they can be sort of individualized, but we often recommend using what we call a 0 to 10 numeric rating scale, where it's just a 0 to 10 scale, and you can rate your symptoms on the scale from 0 being no symptoms to 10 being sort of maximal symptoms. So you could rate it for your pain. You might have sort of pain, for example, at your knee joint, so you might rate your knee pain, or it may be that fatigue's your main symptom or your main problem. So you might rate your fatigue, or you might rate your joint stiffness, or you might rate another feature that you're having trouble with, your sleep or so forth. So, taking just a rating of your symptoms at the beginning and then recording that somewhere so that you can do this on a regular basis. You might do it once a month to see how you're going and to see whether you're improving. There are also some functional tests that you may want to do. And again, depending on your sort of baseline level of your physical function and how impaired you are, there might be different tests that are relevant. But a good one for many people is the 30-second sit to stand test. And this is essentially where you count the number of times you can sit to stand in 30 seconds. And then again, you can use that to guide whether you're improving or not. So that's a really good test, gives a good indication of your overall lower limb strength. You can also do a stair climb test where you can time how long it takes you to ascend and descend a set of stairs. And so you might have some steps at home, or you might have some outside, or somewhere that you could just time how long it takes you to ascend and descend a set of stairs. You could do some walking tests. There's some validated walking tests, although they can be a bit difficult to do at home, but one is the 6-minute walk test, where you work out how far you can walk in 6 meters. So if you've got a passageway and you know how long it is, you can work out how far you can walk in 6 minutes. Or you can do a 20-meter walk test where you time how long it takes you to walk 20 meters. Or if that's a little bit difficult because you're having to get out, take measures and so forth, you could even, when you're out walking, time how long it takes you to the length of your street or between two trees. So you can time yourself with your walking to see whether you're improving your walking speed. You could do a balance test. You could time how long you can balance on one leg, or if that's too easy, you can time how long you can balance on one leg and closing your eyes at the same time. But obviously always do that near a wall or a table for safety. So taking these tests, as I said, gives you a really good baseline that you can then use to see how you're improving. And that, if you then show that you're improving, that can also be really motivating to show what what you're able to do at the beginning and now what you're able to do as you've undertaken an exercise program. So now then you've taken your baseline measures. How are we going to then, what's the exercise program going to look like? Well, if we look at what physical activity guidelines recommend, what do they tell us that we should be sort of aiming to do? Well, they say that doing any physical activity is better than doing none. And so if you're currently doing none, start by doing some and building up slowly. So I think the message there is doing something is better than nothing. So get out, do something, because that's going to be better than not doing any. They also recommend being active on most or preferably all days every week. So scheduling in some time to be active every day of the week if you can. And then what they recommend is that you accumulate, so in total over the week, you accumulate about 150 to 300 minutes, which equates to about 2.5 to 5 hours of moderate intensity physical activity, or 75 to 150 minutes of vigorous intensity physical activity, or a combination of all of those each week. So they don't say that you have to do it all at once, but build up for that, and generally often in sort of chunks of 10 to 15 minutes at a time. So just being physically active for a small portion of time and then accumulating that over the week is what's recommended. They also recommend that we all do muscle strengthening exercises on at least 2 days each week. And they can be done at home or they could be done at a gym. Oftentimes we see we're all kind of aiming to try and get 10,000 steps a day. You might have wondered where the 10,000 steps came from. But in actual fact, it was really not necessarily evidence-based. And I think it was made up for someone place, I think it was in Japan, because it seemed like a good number. It was a good round number and people could try and aim for 10,000 steps a day. But more recent research that's come out, and this was published this year, showed that basically 7,000 steps a day was actually really good and linked to reduced risk of chronic disease and death. And so you can see there that compared to doing 4,000 steps a day, if you did 7,000 steps, you could reduce your risk of dying by nearly half, so 47%, reduce your risk of getting dementia by 38%, reduce your risk of getting cancer, dying from cancer by 37%, reduce your risk of falling by 28%, cardiovascular disease 25%. So that's amazing reductions from exercise by doing sort of 7,000 steps, because 10,000 steps is quite hard to achieve. It's actually, oftentimes I'm not getting that even though I'm trying hard. And so 7,000 steps a day is much more achievable. But they also found that even 4,000 steps a day was linked to much better health outcomes when compared with very low activity. So even trying to aim to get to 4,000, or even if you're less than that, start trying to aim to 1,000, building up. But again, the message is doing something is better than doing nothing. What about when we're designing an exercise program, a structured exercise program? Well, there's no one size fits all. So a program that fits one person and suits one person is not going to suit another person. And there's a whole range of factors that are taken into account. The type of condition that you have, the joints affected. If you've got an upper limb mostly affecting the upper limb, then your exercise program might focus more on the upper limb versus if it's at the lower limb. Your pain levels, your functional capacity. If you're starting off from a very low baseline, then your exercise program is going to reflect that. If you've got other health conditions and so need to work on other aspects, or your preferences, what you actually want to do is going to be really important as well. And then there's the exercise goals. What are you trying to achieve? Are you trying to reduce pain, improve function, improve joint mobility, increase muscle strength, improve aerobic fitness, or reduce falls risk? Because the type of exercise that you do is probably going to then be dictated by really what you want to achieve with your exercise goals. And so, as I said, there's a whole range of different exercise types. There's strengthening exercise using, resistance, whether you use weights or body weight or elastic bands. There's stretching and flexibility exercise. There's a whole range of aerobic exercise where we increase our heart rate and get our breathing going, walking, cycling, stationary cycling or normal cycling, using the stepper. There's mind-body exercises such as Tai Chi, yoga, aquatic exercise in the water or swimming, balance training, dancing. There's a whole range of different exercise types that you might want to consider and doing depending on what you want to achieve. Then how should it be delivered? Well, you can either do it, individually one-on-one. You could go to a class space. You could do it at home. You could go to a gym. You could do a combination. You might go to a class space and then you do some at home as well. So there's a whole range of different exercise delivery types. And oftentimes what we find is you actually get similar benefits for pain and function, at least, for many of the musculoskeletal conditions and arthritis by however it's delivered and by a different variety of exercise types as well. And you can also access online exercise programs so that don't cost anything. So it doesn't have to cost you money. You don't have to go to a gym and pay money. You can access exercise programs online. And we've done quite a bit of research in osteoarthritis, and these exercise programs would also be relevant for other musculoskeletal conditions or arthritis as well. And this was a 6-month strengthening exercise program called My Knee Exercise. It's freely available and you could access it there if you you take a photo of that and go onto the web link there, or you can see the web link there. And we've tested this in clinical trials and shown that it does improve pain and function. So people can do this at home in their own time and follow along, and there's videos and so forth. So that's a strengthening exercise program. We've also done one for hips. This is My Hip Exercise. We've just released this one. A similar thing. It's a 6-month free exercise program to help people with hip pain and hip osteoarthritis manage their symptoms as well. So you can go along and have a look at that and see if that's something you can want to do. And also, as I said, it really is a lower limb strengthening exercise program, so would be suitable for people that have problems with their function and so forth. We also put together a yoga program, again suitable for people with arthritis. It's a 3-month yoga program. It's designed specifically for people with hip or knee osteoarthritis, but as I said, again, you may have other kinds of arthritis or other musculoskeletal conditions where this would be suitable for. And we again tested this in a trial, so you can access there. It's called My Joint Yoga, and it's at myjointyoga.com.au. And you can watch along with the videos and do that at your own home as well. And another suite of exercises we've got, if you'd like to try Tai Chi. We put together a free 12-week Tai Chi program, and you can follow along with the instructor and do that home program as well. And we've just shown that is beneficial for a whole range of factors. It was beneficial for pain and function, people's mental health, their quality of life, and so forth. So again, this might be something that you want to try. So here again is the summary of the 4 different exercise programs that we've put together and tested and made freely available, suitable for people with arthritis. My Knee Exercise, My Hip Exercise, My Joint Tai Chi, and My Joint Yoga. The next thing is about, exercise dosage. So you might think, I'm going to do a walking program. I'm going to start by doing some walking. But how hard should you walk, and how often should you do it, and how long should you do it for? Well, I think the first thing is just to start low and go slow. So that's a good starting point. So really work out, what your level is at the moment and just build up from there. Just take it easy to begin with and then build up and progress. That's the main thing, is to have a progressive program. If you're already exercising, then obviously there becomes a level where you can't keep on progressing, but you can maintain the level that you're at. In terms of exercise intensity, you can use some of these scales that people often use. There's the one on your left is the Borg rating scale for aerobic exercise, and the one on the right is a modified Borg scale for resistance exercise. And so basically what you can do, you want to be working, if you look at the one on the left, you say you're going for a walking program or you're doing some cycling, you want to try and work at sort of a level of, get yourself progressed up to a level of sort of 3 to 5, working at a moderate to hard intensity. But obviously at the beginning, you might start at sort of 1. So this is where you'd rate your intensity of your program. So you might, where would you put it? How intense do you think you're working? Are you giving it a 10 where it just feels like you've run your hardest race ever and you can't hardly get a breath? You can't, which you don't want to be doing, but are you there, or do you think it's like it's really easy or moderate? So this gives you an idea of the exercise intensity that you should be working at or aim to be working at. And then you can see on the right, the one for strengthening exercise program, the weight should be heavy enough and the exercise should be sort of heavy enough that you would give yourself a 3 to 5, working at a sort of a moderate to strong level there. So then there are guidelines and recommendations about, the exercise prescription and what you should be doing and how often and so forth. Again, these are guides and you build up to that. But what they say is if you're doing aerobic or cardiovascular exercise, you're getting your heart rate up. As I said, I've mentioned there that we want to aim for 150 minutes of moderate activity or 75 minutes of vigorous activity per week. And you spread it across the day, so you can break it up into sort of 10 to 30 minute sessions. If you're doing strength or resistance training, then what you're aiming to do is 8 to 10 repetitions of 8 to 10 different exercises that sort of target the major muscle groups. So you would, you might do 2 sets of those. You might start off with 1 set. So you might be doing, for example, strengthening a half squat, and you do 8 of those, and then you might do another set of 8. And then you might build up to doing sort of 8 to 10 different exercises. And then how often, aiming to do it for sort of 2 to 3 days per week, but non-consecutively. So you need to give the muscles a bit of time for rest in between your programs. Flexibility or stretching, to try and stretch out the muscles, the joints. Hold each stretch for 15 to 30 seconds. Repeat 2 to 4 times. And again, focus on those major muscle groups. And then balance exercises. It's recommended that you do 10 to 15 minutes of balance activities 2 to 3 days per week. So you might be standing on one leg, you might be standing with one foot in front of the other, and doing those on 2 to 3 days per week. Well, what do you do if you have pain during exercise or you're having a flare of your condition? So we know that when you start, it's common for you to experience some pain afterwards in the muscles, and that we call that often delayed onset muscle soreness, and that's very natural. Even your elite athletes will have that if they're building up their exercise. So that's sort of natural to have some pain, muscle delayed onset muscle soreness. That generally goes away after sort of 24 to 48 hours, but you will do that when you're starting. I just started back at the gym, and I can feel that my chest muscles are pretty sore after the workout. But what about during the exercise? Is it okay to have some pain during exercise? Well, this was a study where they looked at the outcomes for people with musculoskeletal pain, chronic musculoskeletal pain, and comparing when they did exercise with pain versus when they didn't have pain. And interestingly, they found that when people were doing some painful exercise, they actually had some greater benefits in terms of overall pain and function in the longer term than people that were doing pain-free exercise. So what we know is that it's okay to feel some pain during exercise, and we call that acceptable pain. We know that you're not damaging the joint, you're not doing any further damage by having some extra pain while you're doing the exercises. Now, obviously, you don't want it to be very severe pain, because you're not likely to stick at something when you're getting very severe pain, but it's okay to have what we call acceptable pain, and we call that as generally severity of pain that is rated no more than about 6 out of 10. And it's also acceptable so long as it sort of settles within a few hours after exercise. So that's fine. If you're doing exercise, you feel some increased pain while you're doing it, that's fine. It's still there for a little bit afterwards, but it settles down, then that's fine, as we said. But it may be that you've done a little bit too much and you've aggravated things. You haven't caused damage per se, but you might have just flared things up a bit. If you've got severe pain, so if it's very severe, or you've got increased night pain, that night it's very, very sore, you can't sleep, the next day it's much worse, or you've got some increased swelling of the joints, that indicates that you may have done a little bit too much. So what do you do in that case? Well, what are some of the strategies that you can do? It is a bit of a trial and error. People respond differently with different exercise programs. So you may need to just work out which one's going to suit you the best, and play around with what's going to work best for you. So don't give up the first time you do something. Oh, that just didn't work. Trial and error. Try different things, try different programs. You might need to cut back the program. You might need to change it a little bit, cut back what you're doing. Don't do as many exercises, don't do as many repetitions, don't walk as far. So just cut back on the program. You may need to modify it in some way. Leave out an exercise. If there was one particular one that seemed to be a bit aggravating, leave that one particular exercise out, or modify it in some way. Or you may need to change the program. Maybe you would be better to do some water-based exercise to start with. You might need to change it. Maybe the walking didn't suit you and you're better to do some cycling, stationary cycling. So you might need to try a different type of exercise and see if that suits you better. You might need to take some Panadol for 20 minutes before you exercise or afterwards. And you might need to apply some ice or some heat afterwards to just help settle it down. So try some different strategies and see what works, but you don't necessarily have to don't stop the exercise program. You can still look at ways that you can still keep on exercising, but just change it. Then there's this overactivity cycle where people do too much, then they get really severe pain. So then they have prolonged periods of rest. And then that long period of rest, they then go again, then they're too overactive and they get severe pain. So they get into this overactivity cycle, which in the end leads to them being less active because they find then that they can't be as active. What we want to do instead is activity pacing, where you do moderate activity and then limited rest so that you can do more because you're not having such prolonged periods of rest. To do activity pacing, think about your tendency there. If you've got some tendency to overdo it, and is there some activities that you do overdo that really sort of increase your pain and lead you to having increased rest? And then think about that activity and then set a time limit that's a little bit less than you think you can do, and that's not going to aggravate your symptoms, and then set the amount of time to rest. So basically, you don't want to keep on exercising or doing that activity till you're really sore. Stop before then, and then set the amount of time that you're going to rest. And then try the plan. When you reach the activity goal, just stop, even if you think you're doing really well and you could go further, stop and then rest for that allocated time, whether it be a day or a few hours. And then record the time on the task, your rest time, and how the activity felt. So you might do 10 minutes of the activity, 10 minutes of rest, and then see, yes, I'm feeling good. And then if delayed pain occurs, then you might adjust your activity. You might decrease the activity time or the intensity or the pace, or just increase that rest time a little bit. So playing around with this cycle to see how you can better pace the activities that you're doing. You can also undertake to learn some strategies to help you cope with pain. And we have this free 8-week online program. You do it once a week. It's a module once a week that goes for about an hour. And you can do it in your own time. And it teaches you a whole range of different strategies. It teaches people with chronic pain a whole range of different strategies to help manage your pain. And then you can see which one works best for you. But it's like a bit of a smorgasbord where it lets you try different strategies to see which ones might cope best. There's things such as activity cycling or pleasant imagery or relaxation techniques or dealing with unhelpful thoughts. So again, this is something that you may want to try. You can go there to that website, and it's, as I said, freely available. And then the last thing that I just want to talk about is how can you stick to an exercise program? Because let's face it, you know, for many people, it's not necessarily enjoyable. It's not something they really want to do. So how can you stick to it? Because you're not going to get the benefits unless you do stick to it. So just have a think for yourself. You know, what makes it hard for you to stick to exercise? What are the things that are getting in the way of you exercising and sticking to exercise? And then on the other hand, what things help you stick to exercise? What things are going to help, or do you think might help you stick to exercise? So there's some research, and there's, you know, many barriers to physical activity. We know that, and everyone has barriers to physical activity, but for people with arthritis and musculoskeletal conditions, many of them are inactive in part due to sort of 4 main barriers. Physical barriers like pain and fatigue, where people can, you know, feel like they don't want to do exercise because they've got these physical factors. Psychological, you're just not motivated because you have pain and fatigue, or you might be fearful of pain and fearful that it's going to get worse and fearful that you're going to damage the joint. Or you might lack this support system. You don't have the social support system in place. Or environmental factors such as, you know, fees, or there's no transportation, or you don't have a safe place to exercise, and so forth. So there are a number of barriers to exercise. So it is hard to change behaviour. We all know that, but we can use behaviour change techniques and behaviour change theory to help us look at ways that we can change our behaviour. And one of the key techniques is to set goals. And these goals, we call them SMART goals because they need to be specific goals. So they have to be very clear and specific about what you want to achieve. They need to be measurable. So your goal needs to be something that you can track to see how you're progressing. It needs to be actionable. That means it needs to be something that you can do. It needs to be, you can't say, oh, I'm going to, climb Mount Everest if it's really something that it's not going to be able to be actionable. It needs to be realistic. That might be the Mount Everest goal. It needs to be something that you think that you can achieve. And you don't want to set your goal too high because that's going to give you stress and frustration if you're not going to be able to attain it. So it needs to be something that's realistic. And then it needs to be time bound. That is, you need to have a date when you want to achieve it by. Is it in a week? Is it a year? So you need to make it time bound. And we generally say don't set really long-term goals. Set a series of short-term goals that you can achieve. Then you can set another goal. You might have some medium and longer-term goals that you're aiming for, but set yourself some short-term goals so that you can see that you're achieving them to work toward those longer goals. Now, as I said, these SMART goals, this top one isn't a SMART goal. I want to get in shape and get stronger because it's too vague. It's not really helping me to know what I have to do and by when. So something like this is much more a SMART goal for the next month. So there's your time for the next month. I'll walk 3 miles at a brisk pace on Monday, Wednesday, and Friday at 8 a.m. So it's very specific. It's measurable. You can tell whether you've done it or not. It's actionable. It's something that you can do, and it's realistic. It's something that probably can be done for this particular person. So work out some SMART goals for yourself. But also, don't forget, they're not just sort of exercise goals. What you want to be doing is working toward, you're exercising for some reason. You're not just exercising for your exercise per se. You want to be able to do something. What your goal might be, I want to be able to get onto the floor and play with my grandchildren, or I want to take that trip to Venice that we've been planning, but I've been nervous about being able to get on and off the cruise ship. So set yourself some goals that your SMART goals are working toward, that are the goals that are meaningful to you and that are going to influence your life and your quality of life. Build routine and consistency. Link your exercise to daily habits. Like, for example, I'm always going to go for a walk after breakfast. So, schedule them into your routine to become a habit. Schedule sessions at the same time or same time of day, it's supposed to be, to form a habit. Now, that might be difficult, but again, you're trying to work and building it into your schedule. Monitor your progress. This is really important because that can help motivate you, keep you on track. So you can monitor your exercise progress using just a simple diary that you can fill in on paper, or you can use apps or you can use activity trackers. You might have a smartphone. You can use pedometers, things that are going to track and help you show whether you've reached that exercise goal. And there's smart everything nowadays. There's smart watches and smart belts and smart shoes and so forth. You can also track your symptoms. As I mentioned before, if we've taken all of those baseline measures, you can use those baseline measures to see how you're going in terms of your outcomes and your symptoms. And there's a whole range. If people are interested too, they can go on and find different apps and so forth to measure their symptoms and track their symptoms. We don't recommend doing that necessarily every day because symptoms go up and down. And so it's better to sort of look at, over a time period, over a week or a couple of weeks or a month to see how you're progressing. And then reward yourself for achieving your goals. Pat yourself on the back, reward yourself. Say, right, I'm going to now, I'm going to go off shopping, or I'm going to do something that's meaningful to you to reward yourself. Look to have some support and accountability. It always helps if you've got someone that you have to be accountable to or that's helping you with support. So you might go to a supervised program. You might go to group classes. You might find an exercise buddy to do it with, or regular check-ins. Get someone that you want to check in with and get them to ask you, how did you go this week? Or so that someone that you can check in with can really help as well. And then problem solve barriers. Plan alternatives for, if it's bad weather or you've got a busy schedule coming up, or it's Christmas, what are you going to do? How are you going to fit your exercise program in if you've got the family coming to stay for a week? Or if it's terrible weather and you normally go walking outside, what are you going to do? Well, maybe you could go to the shopping mall and go for a walk around the shopping mall inside. Or if it's really hot outside, you could go to the shopping mall because it's air conditioned. So think about what your barriers are, and then think, well, how can you problem solve those barriers? If you, as I said, if it's scheduling, how can you then fit it into your schedule? What things could you prioritize, or what things can you put in place to make sure that exercise gets into your schedule? And we released an app, a free app called My Exercise Messages, and it was designed again for people with hip and knee osteoarthritis, but it could be used for any arthritis condition. It basically asks you to put in what's your target exercise number of exercise days for that week, for the weeks. So it doesn't prescribe you an exercise program, but it says, well, how many days are you going to exercise? So this person has put in that they're going to exercise, for 4 days this week, but they only exercise for 3 days. And so what it then does is it asks them, well, what made it hard for you to do all of your 4 exercise sessions this week? And you pick your barrier that was the most. And then, for example, this person has ticked, well, they felt that the exercises were going to be harmful. It then gives you a message that addresses that. And then also you can track your progress as well. So if you're interested, you can go to the App Store and get access to that. We also tested this in a clinical trial where we had 2 groups. Both groups did the exercise program, but one group also did use the exercise messages app, and we showed that improved home exercise adherence. So that might be something that you want to try to help you stick with what you're wanting to do. So to finish off, my take-home messages are: we know that exercise is beneficial and it's safe for people with arthritis and musculoskeletal conditions. Determine what you want to achieve from the exercise so that you can sort of pick that's best for you. Consult a health professional if needed. Set some SMART goals that are short-term goals, but have those meaningful life goals in place so that you can work toward those. Pick exercise that's appropriate, that fits in with your goals, and that's something that you want to do. If you don't like walking, don't choose that. Choose something else. If you don't like the water, then choose something different. So choose exercises and programs that fit with you, and you can vary them. You could do a 3-month strengthening program and then do a yoga program. Monitor your progress to see how you're going, and set in place strategies that are going to help you stick with your exercise program. But I think one thing to mention as well is we all fall off the wagon. We went to Port Douglas to Hamilton Island for a holiday, and then I came back and I didn't do much exercise for a month or so. Now I've got to get back into it. So we all take a break. It doesn't mean that's the end. We can get back on, start up again. So we don't have to, that's the end. I'm no good. I'm hopeless. I can't exercise. We can always do something and start again when we might have a period where we've had to, take a break. So thank you for listening, and I hope that's been beneficial. I'm happy to take some questions.
It was amazing, Kim, and I think certainly listening to it, and I'm sure everyone who was taking on board what you said, it was that it's so refreshing to hear an expert like yourself say it's okay to go low and slow, to start out with some form of physical movement. It's better than nothing. It's better than being sedentary, because I think what happens, and certainly the feedback we've gotten from our stakeholders and people living with these conditions, is a lot of times when they go and see a medical professional or a healthcare professional, they go away with this feeling that it's all or nothing. You've got to exercise, you've got to lose weight, and if you do that, that's going to make things better. And it's a bridge too far.
Exactly. And some interesting research has come out, and we're doing a study as well that showed that when they did 1 exercise versus 5 exercise, it didn't really make much difference. You still got benefits. So I think, as you've said, the message is that do as much as you're able to and can fit in with, and that's going to be, useful.
Now, we've got some questions flowing through. One that I want to kick off with is, When you're talking about something like hip OA, and you referred to some of those programs that show exercises and flexibility, strength training, are all exercises created equal?
For research in osteoarthritis, yes, similar. You get similar results from all different types of exercise. Stretching and flexibility would generally need to be added in with an exercise program, but the benefits are similar whether you do Tai Chi, whether you do yoga, whether you do a walking program, whether you do a strengthening program, which is, I think, it does also make us think about, well, what's the mechanism that's causing the pain relief if we're getting it all from all these different types? But I think a lot of it is also psychological in terms of feeling better, feeling like we're in control of our pain, taking control. So I think that's good news, because it does mean that you can choose what you like to do the best. If you don't like to do a strengthening program, you can choose to do Tai Chi or some yoga, or choose what you like to do and that you find beneficial.
As you're aware, given that it's Musculoskeletal Health Awareness Month and we're leading up to the world's biggest sit-in, which I'll tell everyone about in a little bit, one of the things that our ambassador for that, Luke Hines, was saying the other day is, if you've got a chair, you've got a gym. And I think that's a really important message that you sent through in your presentation as well, is it doesn't have to be about joining the most expensive gym. And look, I'll speak from personal experience. Do I like exercising? No. Do I know it's absolutely necessary? Yes. Have I joined a gym? Yes. Do I enjoy going? Well, not really, because someone who looks like me, I'm not a machine. I don't have muscles on top of muscles. And you're looking around the gym and you see all of those people. And I think that's where a lot of the psychological stuff comes in as well, isn't it, Kim? It's what environment do you put yourself in so you feel comfortable and you feel confident in doing the exercises?
Agree. And I saw someone asked about sort of GLAD, there's the GLAD program and so forth. I mean, all of those are really good options for people to choose. Some people do like going to a group program. That's great. I prefer to do it by myself. So I think it's around having options. So, doing group exercise, whether it be GLAD or other group-based exercise, is fine. That will be equally as beneficial as doing a home program. It's really what's going to suit people the best. And some people like going for that social aspect and seeing and getting the support from others. So yeah, again, as you're saying, it's very, I think that's why it's good. It's something that you can then choose that's going to work best for you.
There is a question about, has there been any apps or programs released around exercise programs specifically for your back? So if you're suffering from back pain, I imagine.
Sure. I'm not aware, because our research isn't into back pain, but there probably is. But having said that, the research on back pain, and I'm just here up at the ANZMUS conference, where I just listened to a whole session on back pain and exercise and so forth, really is for chronic back pain. Any exercise, any movement seems to be, again, same thing as osteoarthritis, equally beneficial. So again, to me, I think you'll get good benefits where if you do, you could do our Tai Chi programs, our yoga programs, you could go for walks. So there's a whole range, again, I think, for back pain that would be suitable. And there probably are programs out there. I'm just not aware of them, but the general principles are the same.
Well, interesting you say that, because MHA has been involved with a research project with Manuela Ferreira at the University of New South Wales, the Text for My Back. And the outcomes of that research is showing very similar results to what yours did with that texting program, is that those prompts do actually help people stay motivated, keep moving. And what I like about what you've been talking about is, I know we use this term exercise, and to me, exercise is like that structured approach. It's I'm gonna go for a run, I'm gonna go to the gym, I'm going to lift weights. But what it is actually about is physical activity and being less sedentary, isn't it?
Yes, and as you said, it was said there, when we only have to accumulate the activity. So that could be anything: gardening, dancing, as I said, any of the activities, parking your car a little bit further away when you go to the supermarket rather than driving round and round trying to find the closest park, just park a little bit further away, walk to there. So it's accumulating, as you said, being more physically active just in everyday life as well.
And what I think is really critical about what you were talking about tonight is this isn't an age-related thing. This physical activity, having that mindset to move, movement is medicine. It's across all age groups. And as you said in your introduction, all right, this shows great benefit for people living with musculoskeletal disease, but it's also about having good musculoskeletal health. So if you start these things and maintain them, the younger you are when you start and maintain these being moving physical activity, the better it is actually for your overall health.
Yeah. And I think, as I said, one of the biggest barriers that we've found and research has found is where people think because they've got pain and they're, they're very weak and their function's down, they shouldn't be exercising. And that's exactly the opposite. They should be exercising. It's not unsafe. Because I think that's this fear that it's unsafe. And as I said, they start to exercise and they feel pain. And so they stop because they think that's not beneficial. But it's not damaging, and it is in fact going to have the opposite effect. It's going to improve pain over time.
So we've got a question here, and this is a very specific one. So understand, Kim, if you can't answer specifically. Sure. But one of our viewers tonight says they have OA right through their spine and in every joint and have fibromyalgia. And do you find it really hard to find any exercise that doesn't cause a flare-up? Yeah. Is there, and even said water-based exercise doesn't help. What could you look at there? Is that more about just trying to move as opposed to structured exercise?
I think you're right there. It's really around moving, keeping moving. And, when they say it sort of doesn't help, I think it's, as much as you can do, and knowing that even though that the person has put that they've got sort of pain throughout, it's okay if they're feeling a little bit of extra pain during the exercise. That's still okay. And, so long as they're not, then, as I said, that the severe pain and it's lasts, if that's okay, if they've got pain during, so long as it's not too severe, to keep going and finding something that they can do, even if it's just, as you said, sitting in the chair, doing some stretches and so forth. Just keeping moving is the key.
And I think what you said about that, the pain scale, and understanding that, because I think we have been conditioned through our medical system, through also society, that pain is bad. But when you're talking about movement, physical activity, making sure your muscles, bones and joints stay moving, stay as healthy as they can be, that knowing those levels of pain is so critical to keeping moving.
Yeah. Well, Annette might also find that pain trainer course useful. I don't know, trying something like that where because she said that she's in pain, a lot, 24/7, which, that's hard. So, you may want to try the pain trainer course, which goes through a whole range of different strategies, not exercise, but a whole range of, it's a cognitive behavioral therapy course. It's cognitive behavioral therapy and looking at some strategies to help deal with pain, and to see whether that can help as well.
Interesting question, and I'll do a little bit of an anecdote. One of our staff members has terrible OA of the hip and has seen orthopedic surgeons who have said, oh, you need a hip replacement, and it's like, no, I don't think so. And went to one orthopedic surgeon who said, well, actually, no, at this point in your life, I would not be doing a hip replacement, but you need to rethink the exercise and physical activity you engage with, because this person was a runner, they were a professional cricketer, and the psychological reaction to being told to rethink the engagement in exercise and physical activity was visceral. It's like, no, I'm going to run, I'm going to do, and the suggestion was, have you thought about cycling? Cycling is, and this was one of the questions that have popped up, that someone has NEOA and is using an exercise bike a good option?
Yes. Yep.
We get back to what you said. Any option is a good option if you're moving.
So exercise bike is good. And I used to go, exercise bike to me, especially like those stationary ones, I find them really boring. But if you sit, so when I go to the gym, I sit there and I watch Netflix episodes, and then I can sit there for half an hour on the bike. So yeah, exercise bike's good, but oftentimes it's you don't do it. You know, people have them out in the garage. So, but you can find ways to make it interesting. Walking on the treadmill, if you don't want to go outside. Again, I used to set up my, back in the DVD days, but I'd sit there and I'd walk and watch the DVDs or run watching the DVDs. So ways to make it something that you're going to do.
A couple more questions before we round out this amazing evening, and I do want to thank you, Kim, because you juggled around a hectic schedule and you have been presenting, as you said, up at the ANZMUS conference, so I want to thank you for that. Graham has said he finds it hard to start and get motivated, and that gets back, I suppose, to those SMART goals, because we're all guilty of saying, I want to look fabulous, I want to be a size 8, I want to, and they're completely unrealistic and unachievable. So what, and one of the comments Graham made in his question is he doesn't want to look silly. And I think a lot of us have that fear that if we engage in some sort of, say, organised sport, or we go to the gym, we're going to look stupid.
Yeah, so I totally get you, Graham. It's but I think, as you said, Helen, setting some SMART goals to begin with that you can achieve is really important, because it's motivating when you achieve something. So if you can set yourself something, even if it's for the week, right? This week I want to do X, Y, and Z. And it's just make it really short, so that then you get to the end of the week and you've done it, hopefully. You can, that's motivating. But also, as we said, Graham, think about what are the barriers for you then not doing it. You obviously said you want to do it. What are the barriers? And if you say, well, you're not motivated, I think what you do, the psychological technique is decisional balance. Well, if people aren't motivated, to try and get them motivated, what are the pros of you staying inactive, Graham? Like, what is the pros? And you go, well, it doesn't take much effort and I do whatever. What's the cons? Like, what is the bad side? Well, I can't get down with my grandchildren, or I can't go and do this. So look at what the pros and cons are, and so that you can kind of weigh up. Do you want to stay status quo, or what is it that you want to do it for? So I think having those, the SMART goals are not really, you're doing them to get somewhere. As I said, it's those life goals. Why are you doing the exercise? Like, what do you want to get out of it? What are those meaningful things that you want to be able to do? We've had people in our trials, someone walked the Kokoda Trail. He hadn't done exercise and he had pain, and then he ended up walking the Kokoda Trail, which was amazing. I think he never ever thought he could do something like that, but set some smaller goals and got there. So I think, setting the goals, looking at what are the barriers, picking an activity that he thinks he's going to enjoy. For that.
That's phenomenal. And talking about setting goals, how do I put this? Sit happens when you're trying to achieve a world record. And that's exactly what we need from everyone on the webinar this evening. We need you to register, to sit down and to get moving with Musculoskeletal Health Australia. And this is our attempt at breaking the world record for the largest 30-minute chair-based exercise workout ever held. And we need you. So join us in person at the Ripponlea Estate in Melbourne, or Zoom in virtually for a workout from anywhere in Australia or even the world. At the in-person event, you can meet our amazing WBSI ambassador, Luke Hines, and our incredible MHAM ambassador, Gerald Quigley, as well as partaking in the mini Musculoskeletal Health Expo, where there'll be good coffee, gelato, and lots of stalls with information and giveaways that will be good for you and good for your musculoskeletal health. So please join us on Sunday, the 26th of October at 9 a.m. and get your name in the record books. So we've got it up on the screen. Head to wbsi.org.au and register your seat today, because if you're sitting, you should be moving. Now, I want to take this opportunity to thank everyone who's joined us tonight. I want to say a huge thank you to Kim. What an incredible presentation. I've listened to you speak a number of times, Kim, and it is always informative and insightful, and to dive into a topic that is so serious and important to everyone, but to give everyone those takeaways that we can all use in our everyday life is so fantastic. So a huge thank you, Kim.
No problem, and good luck to everyone.
Thank you. Now, final notes, we've got our second MHAM Consumer webinar next Tuesday at 7 p.m, and we'll be talking about all things workplace, the importance of flexible work arrangements for workers and their rights to ask for them within a musculoskeletal context. So on behalf of MHA, I want you to get sitting. I want you to get moving. We will see you all next week, and we will see you all on the 26th of October. So thank you, and thank you, Kim.